Hello, I'm David Hutton, Executive Editor of Ophthalmology Times. The American Society of Cataract and Refractive Surgery is hosting a virtual annual meeting for 2020. Today I'm joined by one of its presenters, Dr. Michael Saidel, who discussed evolution of an administration technique for dexamethasone intraocular suppression 9%. Thanks for joining us. Could you tell us about your presentation?
Thanks for having me. So the presentation is about using dexamethasone injection into the eye. It's known as DEXYCU. And it talks about the evolution in my usage. So when I started using it, I used the essentially on-label technique, and that has changed over time. And I've learned a great deal more about the use of the medicine, how it is to be administered, what situations I use it in, also what effects I can expect in different pathologies and different situations.
And what does this mean for ophthalmologists and their patients?
So what we're talking about is reducing drop usage, figuring out what patients do best with depot medications, what patients do best with dropless systems, um, how I can streamline the practice for my patients, what the future looks like in terms of drug administration, and the future of cataract surgery.
Mhm. And what kind of feedback have you received from patients?
In general, it's positive. For those patients for whom have had a standard regimen of drops in one eye versus having the intraocular dexamethasone in the other, that they've given me uniformly positive feedback. For the patients who have not had a comparison between the two eyes, they don't really know. And in general, it has been positive there as well. But sometimes we will field questions like, for example, my friend had cataract surgery and they had to use drops, but why don't I have to use drops?
And what's the take-home message?
We have medicine that we're very familiar with that we can use inside the eye, and technique for administering it has evolved slightly. So I used to place it just underneath the iris or even in the anterior chamber, and now I'm placing the medicine in the bag. And that's been very effective, and it's given me good long-term results.